Hello everyone, thank you for joining us today. We'd like to discuss some common tests that are done at the clinic, including the stress test, electrocardiogram or ECG, and echocardiogram, and explain what they are, how they are done, and what the results tell us about your heart failure status. We will start off by discussing the exercise stress test, which you either may have heard of around the clinic or have conducted yourself. The exercise stress test is a safe and non-invasive test conducted to measure how the heart functions and reacts under an increased workload. This test can give us very valuable information about your heart health, including detecting if blood flow or supply to the heart is impaired in any way, as is the case with coronary artery disease, and if symptoms or discomfort experienced is due to a heart-related condition, and what level of exercise is appropriate for a patient. Before conducting an exercise stress test, the patient is hooked up to various equipment to help monitor important vitals. For example, electrodes can be attached to measure the electrical activity of the heart and display an electrocardiogram of the heart activity during the test. We will be discussing electrocardiograms in more detail shortly, but also other equipment could also be used to monitor blood pressure, heart rate, and breathing. Then, the patient begins the test, often using a treadmill or bicycle by walking slowly, and gradually the speed and incline will increase, which increases the difficulty of the test. After maximum intensity is reached, the treadmill or bike speed and incline is reduced to allow for cool down. Oftentimes, this is done in a periodic cycle with a few minutes allocated for a cool down before returning to maximum intensity for a set time. The intensity is decreased again. Once the test is completed, the patient rests and final vitals are measured. Although this test may be difficult for many and physically exhausting, your physician will always be mindful of your safety, and the test can be stopped at any time if there are cause for a concern or whenever you choose to do so. If the results of the exercise stress test appear normal, it would indicate healthy heart function and blood flow. In this instance, the test can rule out heart-related diseases as the cause of symptoms experienced by the patient. It will also help indicate that an exercise plan can be developed safely for the patient, and if the patient plans on undergoing surgery for any reason, that their heart is strong enough to tolerate it. As a prognostic tool, it informs us that treatment is working properly and improving heart health and symptoms, and the heart is functioning as it should. However, if abnormal or alarming results are recorded, it indicates that the symptoms or discomfort that the patient experienced that prompted conducting a stress test initially may be in fact due to heart-related issues. It also alerts physicians and patients that their heart may not tolerate exercise or surgery well at this time. In this case, more tests may need to be conducted to determine the heart condition, and lifestyle changes can be made and medications may be administered to reduce symptoms and improve one's condition.
So another test that is commonly ordered in our clinic is the ECG, also known as the electrocardiogram or the EKG. What does the ECG actually capture? The ECGs capture electric signals that are sent by the cardiac muscle in order for muscle contraction. In order for the heart to effectively pump blood, the atrioventricular valves, the two on the outside, and the semilunar valves, the ones on the inside, must open and close together so that the blood can be pumped from the atriums to the ventricle, and then from the ventricles to the rest of the body or to the lungs. The ECG captures these electric signals as highlighted by the yellow beams of light, which causes depolarization of cardiac muscles, hence the heart contractions. So, how do you read an ECG? Here are the basics. One of the most important criteria is the time of a cycle. As depicted by the graph on the left, each small box represents 0.04 seconds, and each big box, as outlined by a thicker black line, represents 0.2 seconds. Electric signals are measured in millivolts, and two big boxes vertically stacked up represents 1 millivolt. There are several important landmarks to look for in an ECG. The first one is a P wave, which reflects the SA node, which signals atrial contraction. The second one is a QRS complex, which reflects the ventricular contractions. And the last one is a T wave, which shows repolarization, which signals relaxation of the ventricles. This cycle then continues on and on in order for effective pumping of the blood. Now, of course, there are other messages to look at when it comes to the ECG, and one of the common clinical practice is the 5-step method. The first step of the 5-step method is to locate the P wave in the QRS complex. The second step is to obtain the time for a PR interval in the QRS complex, and a normal PR interval should be between 0.12 to 0.2 seconds. The QRS complex should be less than 0.12 seconds and ideally between 0.06 or 0.1 second. The third step is to determine if the shape of the wave looks regular or irregular, which we will have examples shortly after. The fourth step is to count the heart rate, which can be determined by counting the number of QRS complexes and multiplying this by 10 on a 6-second interval. A regular heart rate should be between 60 to 100 beats per minute. Lastly, we will look at the rhythm to see if everything is in shape. Another common ECG that you'll see at our clinic is the 12-lead ECG as depicted on the right of the screen. There are a total of 50 small boxes, hence each strip itself is 10 seconds. A 12-lead ECG has the benefit of reflecting spatial information, which can be broken down into left and right, superior and inferior, and the anterior and posterior. This gives a clinician a better representation of different nodes of the heart. To read a 12-lead ECG, you would go from the left to the right as shown on this picture here. There are 12 sections in this graph. On a horizontal axis, we have time, and vertically, we have 3 different signals being presented at the same time. Hence, in the first column, we're viewing 2 lateral and 1 inferior signals. In the second column, we're viewing a ventricular, a lateral, and an inferior signal. And in the third column, we're viewing 2 septal and 1 anterior signal. And in the last column, we're viewing an anterior and 2 lateral signals. So now you might have a question. Can you see a CHF reflected on an ECG? And the answer is yes, of course. CHF will result in a lower QRS voltage, poor R wave progression, and non-specific ST segment and T wave changes. Lower QRS voltage will be reflected, such as this image over here. We don't have those big peaks that we used to see in the middle of the ECG anymore. The total amplitude of a QRS complex is now smaller than 5 millimeters in all 3 standard leads. This can be more prominently reflected in V1 and V6, V2 and V5, as well as V3 and V4 on an ECG. The second way the CHF can reflect upon an ECG is by poor R wave progression. In this case, the R wave is less than 2 to 4 millimeters in leads 3 and 4. This can be shown as a reversed R wave progression as well. Lastly, non-specific ST segments and T wave changes may also occur. As shown by this ECG here, the T wave just disappeared in V1 and is very unsteady in lead 3.